What are the different types of melanoma in dogs? If you are a dog owner, you may have heard about melanoma and its impact on our furry friends. Today, we will discuss the different types of melanoma in dogs, helping you understand this important topic. Melanoma in dogs primarily arises from melanocytes, which are the pigment-producing cells in the body. There are several distinct types of melanoma based on where they occur and how they behave. First, let's talk about oral melanoma. This is the most common and aggressive form of melanoma in dogs. It usually appears in the mouth, affecting areas like the gums, tongue, palate, and lips. Oral melanomas are often malignant and can invade nearby tissues and spread to lymph nodes and lungs. In fact, they account for nearly 40% of all oral tumors in dogs. To assess these tumors, veterinarians use a staging system based on size, lymph node involvement, and whether there is any spread to other parts of the body. Next, we have cutaneous melanoma, which occurs on the skin. These tumors are generally less aggressive than oral melanomas. They can be benign, meaning they do not pose a serious threat, or malignant, which means they can spread. Benign cutaneous melanomas often appear as small, pigmented nodules and may not need aggressive treatment. However, malignant ones can require more intensive management. Digital melanoma is another type that arises on the toes or nail beds. This type is often malignant and can invade nearby tissues. In many cases, amputation of the affected toe is necessary to control the disease. Digital melanomas have a moderate risk of spreading to other areas. Ocular melanoma affects the eye and can develop in structures like the iris, ciliary body, or eyelids. These tumors can vary in behavior. Some are benign while others can be malignant. Ocular melanomas may lead to vision problems and often requiring specialized evaluation and treatment from an eye specialist. There are also less common sites where melanomas can arise, such as the scrotum, lips, and feet. While these occurrences are not as frequent, they still requiring attention. From a diagnostic standpoint, veterinarians use specific markers to confirm a melanoma diagnosis, especially when the tumor cells look unusual. Staging is essential for understanding the extent of the disease, especially for oral and other malignant melanomas. This helps inform treatment options and prognosis. Certain dog breeds, including Airedale Terriers, Boston Terriers, Boxers, and Scottish Terriers, have a higher risk of developing melanomas, particularly in the oral and digital areas. In summary, the main types of melanoma in dogs include oral, cutaneous, digital, and ocular. Each type has its own clinical features and levels of malignancy. Understanding these differences is key to managing melanoma effectively in our canine companions.